Hi, my name is Janet Kanini Ikua. I recently turned 38 years old. I'm proud to say, and I'm very happy that God granted me a new year of life. And today, as I speak to you, I am healed of cancer, lung cancer, stage 4, after 4 months of chemotherapy. The doctors are amazed, and I am just so happy that God has answered this prayer. And I must say, I am grateful to all of you. Last year, I left India after 2 cycles of chemotherapy, and I needed to go back to Kenya and complete 4 cycles. And there was just this feeling of it's a new year, it's a new birthday. I have completed my chemotherapy. I am still standing, and now I am supposed to go back to India for review. And the cycles happened every 3 weeks. It's been a challenging journey, I can't deny. There have been days when physically, mentally, I'm just in pain, I'm questioning, I was anxious, I was confused, I would cry. My husband got so used to me crying once in a while. And in the midst of all that, there was the hope that God will answer this prayer. Because cancer, the thing with cancer, that word, when you tell people that you've been diagnosed with cancer, a lot of them look at you like you're already dead. And unfortunately, as much as you try to get that out of your mind, because there have been success stories, people getting healed of cancer, very many success stories. You try and keep that out of your mind, but too many people think that it's going to go wrong. And so I had to learn to really hold on to God and the promises in the Bible, and to just keep my faith strong. And thank God there were so many people who were also praying for me, because it's not easy to pray every day. I mean, there were days when I was too weak, I was too mentally tired to even think of praying. I would just say, please, God, I can't say the words, but you know what's in my heart. So as my husband and I again, we decided, you know what, okay, so time now to come to India. We planned our trip to last maximum 10 days. And I just hoped that this time around, I would actually get back home to see my children after 10 days. As a patient, it was still necessary for us to inform the hospital in advance that, hey, you know, we're coming, we're due for a follow-up visit, and so we're going to need pickup from the airport, we're going to need accommodation. And one thing I love about Doctors Beyond Borders is that it's possible to email them as well when you're emailing the hospital, so that they are aware of exactly what my plans are as a patient, and they make sure that it gets done. So here's a bit of advice to you. Even if you're contacting the hospital, please always make sure that you contact DBB as well, because they are able to do for you on the ground what you as a foreigner may not be able to do for yourself. And so we came here, and what can I say? Everything has been smooth sailing. And even beyond that, they take the time to come, you know, call and say, hey, when are you free? When are you not seeing the doctor? Where are you now? Can we come and see you? Even when we were in Kenya talking, it just never stops. And with this age of technology on WhatsApp, you know, it's very easy. Just send a message, say, hey, this is what's going on right now. I need to get these reports across and all that. And you know what? It will be done. And that's the assurance that you need as a patient, to know it will be done. Because when you're dealing with life and death scenarios like I have faced, you just need to know that you're in good hands. And I have been in excellent hands with Doctors Beyond Borders. So anyway, we landed in India. And oh, what can I say? A lot of anxiety, you know. There's always this thing. We're human. So there's always this battle between what the body feels. I was tired, my back was hurting from all the traveling. I was on painkillers every single day. But my faith would tell me, no, you're healed, you know. All this doesn't matter. I was still injecting myself because of the blood clotting twice a day. My stomach is so full of injection holes, it hurts if I bend. And I would really just try to, you know, just try to ignore what the body says, because that's what faith is about. Ignore what reality is telling you and believe in what you can't see. Believe in something better. So we got here, and the PET MRI scan was scheduled. went in, got radioactive again. I like making a joke about being radioactive because there are very many superheroes who became superheroes after they were radioactive. So I like to tell my husband, yeah, your wife is now a superhero. So we had an extra 24 hours to wait, and I can't deny that we were anxious. But we were looking forward to a good report because I had already done some blood tests and they showed that the tumor markers, which are a sign of cancerous cells, they had already gone down significantly. So already, that was something great. One of the tests that I also had to do was an echocardiogram to see whether my heart is now clear of the clot. And what they found is that the clot is there. But fortunately it's lodged in the muscle very tightly, it can't move, and it has actually gone down in dimension. Instead of 1.5 by 1.4 by 1.7 centimeters, it's now 0.8 millimeters, all round. So that is some progress that has happened. They did a Doppler ultrasound also to check the status of my deep vein thrombosis in my legs, and it's still a little bit there. So unfortunately I have to continue the Clexane injections for a couple more months. But you know what, that's fine. It's manageable. One thing I like to say is this. Even if I'm going through all these other little aches and pains here and there because of the injection, there are people who are dealing with so much more pain, so much more suffering than I have seen. I am actually very fortunate. And even if the diagnosis said stage 4, which is, a big word. I mean, when you hear cancer stage 4, yeah, it's pretty much you have 6 months to a year to live. So even in the midst of all that I went through, I'm actually grateful that I was able to handle it. God gave me the strength to handle it. And what do they say? What does the Bible say? God's strength is made perfect in my weakness. And that's what I witnessed. So back to the PET MRI scan. Now, this is what is done to, it's a full body scan to really now check the cancerous cells, see if they're there. And I'll never forget when we went in to see the doctor, the chemotherapist, and also the oncologist. And we couldn't look at them when they were reading the report. So, we gave them the report, all the documents, and then we looked down, we looked at each other with my husband, kind of twiddling our fingers, just looking everywhere but at him. Until finally he looked up at us and said, "It's a good report. I'm impressed." And we thought, what? And he said, "Yeah. Janet, the lesions and nodes that we saw in your liver, your abdomen, your bones, gone. The lungs, gone." Oh, I still find it so hard to voice. But basically, I am good. I am healed. And so what has been given now is I just need to do one drug. I was doing 2 very strong drugs, and I just need to do one drug that will barely have any side effects as maintenance for the next 3 months to make sure that, the progress that has been made stays that way. There's no recurrence whatsoever of cancer. And I choose to believe that there never will be any recurrence. As a patient, it's so important to know that everything is in place because, well, I have dealt with a life and death journey, and I just needed the assurance that when I come to India, I will be taken care of. And that is the kind of assurance that Doctors Beyond Borders has given me throughout this journey. If you're looking for excellence, talk to them.